In Arkansas, there are around 11,000 reports to the child abuse hotline every year. When a report's made to the hotline, then the investigation that would ensue from that would involve people from the Arkansas State Police. It could involve child welfare from Department of Human Services, and it often involves a medical evaluation as well, especially if it's a situation where a child may have been injured with either physical abuse or sexual abuse. The CDC estimates that for every case that is reported, that there's another 3 that aren't reported. We really are only responding to the tip of the iceberg.
Thanks to you, these children have great expectations of a brighter future. You can help make a miracle happen, the miracle of Children's House.
In the earliest years of my involvement here, this was a tiny hospital, far from the hospital it's grown to be today. I remember so well with early auxiliary members dreaming of a day when this would be a place that we would bring our own children, that it would be the place of choice for care. Fast forward then to about 30 years ago, during one of the many times that my own son was hospitalized here, and I shared a table in the cafeteria with a woman from Fort Worth, Texas, whose child had been sent here because in Texas they told her the treatment that her child needed was better at Arkansas Children's Hospital than anything they had to offer. It truly seemed like a miracle. We were finally being recognized, not only in Arkansas, but nationwide, as a place of choice for health care for children.
Every child who is sick or hurt needs a miracle. Arkansas Children's Hospital is a place where miracles happen every day.
I think a miracle is something positive that happens in our lives that defies expectations, defies the outcome that we expected.
3 or 4 of us in the auxiliary had a chance to hear Jerry Jones talk. Here was a wonderful man, a doctor, working with one other doctor, not even full-time at that point, and with a part-time staff person in a tiny little space on our campus. They were involved in the nittiest, grittiest parts of child abuse. In addition to that, they spent a good time on the road testifying in trials, training policemen, training social workers, and then on the limited time they had left, trying to help some of these poor families who were struggling. Each of us knew that we had to get the auxiliary involved. The day Dr. Jones finally came to talk to the auxiliary, we were just a wreck. We thought, well, they're either going to hear Dr. Jones and walk out of the room, or something's going to happen here. And I can't tell a story without crying. I looked out at the group and I saw 100 hearts change. And there was not a single person who walked out of that room who didn't leave with the belief that we could make a difference.
You know, our ER, our burn units, our surgical suites, the PICU, we can care for the actual wounds that were so undeservingly received by these children, but only Children's House will give each child the hope for the future, the promise of a better life that they each deserve.
Children's House is a place where children will get to go, that can be cared for when they've been forgotten, when they've been abused, they've been hurt. Children's House will give children in this state a place that they will be safe, they will be loved, they will be healed, and we'll be able to take care of the entire family.
I believe all of us who are passionate about Arkansas Children's Hospital have a promise to keep. We want to make all children better today and healthier tomorrow, including the children who will be served by Children's House.
This new Children's House that's being built will actually be a center for safe and healthy children. It will have all the components that are needed to respond to the upfront allegations of abuse. So that's the Children's Advocacy Center, where police and DHS can come together to be able to do a coordinated investigation, which would not only improve the accuracy of the information that's collected, but also do that in a way that's minimally traumatizing to the child and to the family for going through this. And then the building will also have a specialized medical clinic with people that are trained in how to do the specialized medical exams that are needed for these types of problems. And then also in the building will be clinics that have specialized mental health providers as well. We can't ever necessarily take away that something bad has happened, but we can try to have a response that does the best job for our community and our state as far as having really quality information to move forward on investigations. But we can also try to have all of the support networks that are in place to help children and families be able to recover from something that's been so terrible for them to have to endure.
The statistics on child abuse in Arkansas are staggering, but there is hope. Last spring, Arkansas Children's Hospital broke ground on a brand new facility that will house all of the programs and services available for abused and neglected children. These children truly need a miracle.
Abused children in Arkansas need your help to get better today and to be healthier tomorrow. Until no child needs us, we need you.